From the Daisy nominations received during the month of July, the winner is Maria Ibarra. She has She has received 7 nominations. Here are the nominations. Nomination 1 received September 2012. I have spent 31 days in your facility and had the enjoyment of having several of your fine nurses take care of me. I have nominated 4 others for the Daisy Award and would like to nominate Maria for her kind and compassionate services. I never had to call her. She was always there when I needed something or when my medications were due. She had a sixth sense on when she was needed. Nurses of this caliber make a hospital stay a wonderful experience. I will be back in a month or so to get my hip put back in if the infection has completely gone away. I would be asked to be put back on the same unit for recovery and rehabilitation. From the nurses to the food staff, the floor should be commended for the compassion and caring they show to the common people. Nomination 2 received November 2012. Maria was in and out of our room without us having to call. She was very attentive to the patient. She provided thorough patient teaching and was pleasant. She answered questions without hesitating. Nomination 3 received November 2012. Maria was my dad's nurse the first 3 days after his surgery. She was very attentive and proactive in his care. She made sure he was seeing all the therapists, contacting doctors when needed, and making sure he was up in the chair when he needed to be. Basically, she was anticipating his needs and making sure he was getting everything he needed to recover. We're hearing a pattern here, aren't we? Nomination 4 received January 2013. Maria was efficient, caring, and compassionate. I never waited for anything. When I pushed a button to go to the ladies' room or needed medicine, she was there on a dime. She was personable and dedicated to my needs as a patient. Nomination 5 received April 2013. Maria is such a picture of the perfect nurse. She is very calm, never rattled, always patient and deliberate in her care and her responses. She's willingly helped a new nurse and yet always available to help with anything we needed. She was very understanding of pain and the needs of my mother's hip fracture and replacement. Nomination 6 received July 2013. Maria helped me so much today. I was supposed to learn how to perform an in-and-out catheterization on myself. I did not know how, and I was so embarrassed and humiliated. But this nurse made me feel normal. Maria talked to me and made me feel so much better. She did the first in-and-out catheterization for me, and later when it was time to do it again, she helped me through it every step so I could learn how to do it myself. I would like to thank her so much for taking the time to educate me and being so compassionate and understanding. Please award her the Daisy Award. Nomination 7 received July 2013. Maria was like a breath of fresh air. She obviously knows what it means to be a nurse. Her attentiveness and obvious concern was of a kind not often seen in hospitals nowadays. She even came to my wife's assistance when not assigned to her room. She reminded me of what Trinity Mother Francis was a number of years ago, when nurses had enough time to actually nurse their patients. Well done. Now, it is my pleasure, on the behalf of the Daisy Foundation, to proclaim you, Maria Ibarra, a Daisy Award Extraordinary Nurse. Here is your award certificate, and I'd like to read what it says. The Daisy Award for Extraordinary Nurses. This award is presented to Maria Ibarra, BSN RN, in deep appreciation of all you do, who you are, and the incredible, meaningful difference you make in the lives of so many people.
I get so sentimental. It's just amazing, this unit that we work, the Trinity Mother Francis. so many great people make it an awesome place to be and to work. And I always say that there's two passions in my life, and that would be God and nursing. And to be able to do it under one roof and to enjoy it and love it every day is amazing. So it's not only for me, I dedicate this to, everybody here in the floor, Janice. We have some great charge nurses that make being, as a new nurse, it's difficult, but they make it worthwhile, and it makes you want to come to work. It's amazing. Thank y'all very much.
And I would like to present you with your daisy pin.
I don't really know if there's much more that we can say that wasn't said in those nominations, but working with Maria I'm only a nurse in about 6 months longer than her, but working with her, I've learned so much about the heart of nursing. And it's been such a privilege to see her true passion come out and the way she treats every single patient as if they're her only patient and the most important person in the world to them. And you can see that every day, every time she comes to work. And it's such an honor to be here with her.
And I would like you to have this sculpture. It's your sculpture as a symbol of your recognition today. Now the banner. This banner will hang in our unit this month in your honor. Okay. And the ever popular parking pass, in which she's got right here. A whole month. How about that?
That's awesome.
Now a message from the Daisy Foundation. By definition, the Daisy Foundation thinks all nurses are extraordinary, and we wish we had the resources to honor all of you individually. Nurses who receive the Daisy Award often say, "Everyone in the unit deserves this award as much as I do," or "I don't deserve this. I was just doing my job." When the Daisy nurse may not realize, however, is that when nurses are just doing their jobs, they have such an important and meaningful impact on the lives of so many people, many more than their patients. At every Daisy Award presentation, we ask each nurse to pause for just a minute and realize how very special they are and how they make the world a better place by just doing their jobs. Today, a nurse's job entails many things, but no matter what the day brings, a nurse's impact is invaluable and long-lasting to their patients and families. Thanks to your education and training, your commitment and judgment, your compassion and connection with your patients, you are very special. You make the world such a better place by just doing your job. The skill and compassion you bring to patient care makes a patient outcome more positive and makes a family member feel a little better so they are better able to help with the patient's healing. Please think about the impact you are having. Story after story brings this to light. I would encourage you to look at the National Daisy website and read the stories, and the link is on Nursing Public. Prior to our closing prayer, I want to give a special thank you to all of those who nominated Maria. This award does not happen unless you take the time to write the nomination, and it means a great deal that you care enough for Maria to do this. Thank you for choosing nursing as a career and for the skill, care, and compassion you give to your patients every day. And to Maria, congratulations.